At preoperative workup before using the app, 2 radiographs should be taken, one standing lateral pelvis X-ray including the lumbar spine and one sitting lateral pelvis X-ray including the lumbar spine. Once you load or capture the patient's image, by default the button STD is highlighted, meaning that you have to input preferably the standing X-ray to measure. By clicking the button, point the over the 2 anterior superior iliac spines, ASISs, independent from site selection, left, right, and the pubic symphysis, point P1, P2 and P3 are marked on a lateral pelvic radiograph respectively. The anterior pelvic plane, APP, is drawn, which is defined by the plane passing through the mid-distance of the 2 anterior superior iliac spines, ASISs, and the pubic symphysis, P3, on the lateral pelvic radiograph. The anterior pelvic plane tilt, AP point, is the measured angle created between the APP and the vertical reference line. The anterior pelvic plane tilt AP point, or pelvic tilt, is being neutral, 0, tilted posterior, or tilted anterior, plus. By clicking the button, point the point P4 over the left edge of the superior end plate of the L1 is marked, and by the same manner locating the right edge of the superior end plate, the point P5 is also marked. The order of marking does not affect the measurement. A green line P4, P5 over the anterior and posterior, superior end plate of vertebral body of L1 appears. With the transparent circular template, you aim to locate the posterior corner on the top margin of S1 of the sacrum, and by clicking the button, point, the P6 point is marked, and by clicking also the point button at the anterior corner of the superior end plate of S1 vertebra, the point P7 is marked. Next you aim at center of the femoral head, and by clicking the point button you mark the center of femoral head, C8. Automatically the pelvic incidence angle, PA, sacral slope angle, SS, or anterior pelvic plane tilt, AP point, or pelvic tilt angle, PT, lumbar lordosis angle, LL, PILL pelvic incidence angle, PIA minus lumbar lordosis angle, LL, are being calculated and normal values appears respectively. An asterisk appeared above of button STD, meaning that the measured data are stored in RAM and not discarded. By importing the new sitting X-ray, the data from previous measurement, namely if standing X-ray, are not lost. Once you press the STT button, which is highlighted, you can measure by selecting points in exact the same way. With the transparent circular template, you aim to locate the posterior corner on the top margin of S1 of the sacrum, and by clicking the button, point, the P9 point is marked. Then by clicking the point button at the anterior corner of the superior end plate of S1 vertebra, the point P10 is marked. In case selecting wrong points by pressing the undo button, the procedure backtrack one step each time before finishing the measurements. The asterisk appears above button STT, meaning that the measured data are stored in RAM. The detailed analysis of data by comparing the standing and sitting position is exported, and by pressing the save button, the image and the relevant data are stored. The stored TXT file can be opened with Notepad or numbers externally.